schizophrenia spectrum, and other psychotic disorders. Welcome to episode 2 of our DSM-5 TR series. I'm psychotherapy Cynthia, and today we're talking about schizophrenia spectrum and other psychotic disorders, conditions defined by psychosis, delusions, hallucinations, disorganized thinking or behavior, and negative symptoms. These disorders differ in duration, severity, and whether mood episodes or substances better explain the presentation. The main categories here are schizotypal personality disorder, delusional disorder, brief psychotic disorder, schizophreniform disorder, schizophrenia, schizoaffective disorder, substance or medication-induced psychotic disorder due to another medical condition, catatonia, and other or unspecified psychotic disorders. As a field student, you're often distinguishing transient psychosis from emerging chronic psychotic illness. Delusional disorder involves one or more delusions lasting at least a month without the full picture of schizophrenia, and functioning is often relatively preserved. Rule-outs include obsessive-compulsive or body dysmorphic beliefs, mood disorders with psychotic features, and culturally shared beliefs that are not idiosyncratic. Brief psychotic disorder features sudden onset psychotic symptoms lasting more than a day, but less than a month. With full return to premorbid functioning, you must rule out substances, medical conditions such as delirium, and mood episodes, and consider acute stressors or trauma as possible precipitants. Schizophreniform disorder has the same symptom pattern as schizophrenia, but lasts at least 1 month and less than 6 months, while schizophrenia requires at least 6 months of disturbance with at least 1 month of active phase symptoms. Rule-outs for both include schizoaffective disorder, mood disorders with psychotic features, substance-induced psychosis, and psychosis due to another medical condition such as seizure disorders or autoimmune conditions. Schizoaffective disorder combines mood episodes with concurrent psychotic symptoms and also requires at least 2 weeks of psychotic symptoms in the absence of major mood episodes. The key differential is whether psychosis is fully mood-dependent. If psychotic symptoms only occur during mood episodes, think mood disorder with psychotic features instead. Substance or medication-induced psychotic disorder and psychotic disorder due to another medical condition are used when there is clear evidence that a substance, medication, or medical condition is etiologically related to the psychosis. Clinical rule-outs include primary psychotic disorders and delirium. And you must pay attention to temporal relationships between exposure and onset. Catatonia can occur in the context of another mental disorder, a medical condition, or as an unspecified catatonic disorder, and involves marked psychomotor disturbances like stupor, mutism, and posturing. Always think safety and medical workup first, and differentiate catatonia from severe negative symptoms, malingering, or neurologic syndromes such as akinetic mutism. The other specified and unspecified categories again capture presentations with psychotic features that don't neatly meet criteria, often used in emergency or early phase evaluations. For students in fieldwork, focus on clear documentation of duration, mood symptoms, substance use, and course over time to refine diagnosis. In your current setting, where do you find it hardest to differentiate primary psychotic disorders from substance-induced or mood-related psychosis? And what additional assessment questions would you add to clarify that?